Nobody talked about inflammation 40 years ago. Anybody that comes to my practice as a patient, everybody is inflamed. Your cells going through the process of oxidation. If your brain is foggy, if your gut is inflamed, so will be your reproductive organs. Thinking that you can sleep 5 hours a night and undereat and be deficient and being stressed out all the time and thinking your body will heal, it doesn't. We are God-created beings. Seeing how God created us so we can still repair, it's absolutely amazing. It is. It's amazing.
Hello and welcome back to the 5-hour method. Dr. Yuabova, how are you? How you doing?
I'm great. How are you, Vivek?
I'm excited to talk to you about a very common topic, but I think it's just like a lot of confusion around this. Let's start with this conversation straight up. We hear the word inflammation everywhere, and it's so much confusing. Some people say that it is because of fatigue, some says it's fertility issues, some say it's muscular issues, some says it's aging, some says autoimmune. But what inflammation really is, that's what we want to unpack today and help us understand there is right type of inflammation, there is severe type of inflammation. So that's the discussion. So I'm going to jump in before we label inflammation as bad. What is inflammation actually designed to do in your body?
So inflammation, it's a first stage of healing. We heal through inflammation. For example, you can cut your finger, you can have a scratch, and what you see, it's redness and induration, meaning elevation of the skin. So this is active phase of inflammation. This is how we heal, through this phase of inflammation where we have red blood cells, white blood cells rushed into the area to create healing. So that's healing stage. So that's absolutely normal. We do want to have this ability to repair. What we don't want prolonged inflammation that never stops. So the silent, all the time inflammation, so continuous inflammation that's very silent, that's what causes issues. So it's a very big difference. People don't understand. Active and acute inflammation, that's what we want. Chronic and silent inflammation, that's what we do not want. And that's what makes a big difference.
So let's talk about this, right? Like, what is the difference between what is supposedly healthy inflammation and acute inflammation, and then there is chronic and low-grade inflammation that causes long-term damage?
Of course. So what makes us different? Let's look at what makes us different, because 40 years ago, we didn't have this. Nobody talked about inflammation 40 years ago. And if you think about it, people did not suffer with leaky gut. People didn't suffer so much with arthritis. We know that. 40 years ago was not a problem. Also, we didn't have Alzheimer's so much. We didn't have ADHD so much. We didn't have those conditions. So what changed? Physiologically, we remain the same. We did not change. What changed? Environment has changed. Toxic load has changed. So more environmental burdens we have, it disrupts our proper processes in the system and will cause prolonged inflammatory states in the body that will show itself as Alzheimer's dementia, arthritis, autoimmune conditions. So how do people feel that they have chronic inflammation? Usually constant fatigue, problems with hormones. So all of these are signs of chronic inflammatory states. For men, it's increase in cardiovascular disease, because cardiovascular, any kind of prolonged inflammation will affect the health of the vessels. More inflammation you have, more stress burden and problems burden you will have in your vascular system. So when I have male patients come to my office and we do a very specific, we can see what is the cardiovascular risk for these men. So for me, if I see middle-aged men and the cardiovascular index is elevated due to inflammation, it's always due to inflammation. I know they're in risk for heart disease, metabolic issues. I explain it to them. It's very important because in middle age, very specific risks, very specific heart attacks, which they don't survive. I think we talked about it. Like I tell them, like you're in this age and you have so much inflammation in your system, also call it oxidative stress. So what is oxidative stress? Again, it's how inflamed you are that your cells going through the process, oxidation. We also can say it, process of metal run, because you oxidizing and your cells break down. They don't work properly. This oxidation. It is very important. That's why we do very specific testing to understand where is inflammation, where it's coming from, what's driving this inflammation, and how can we, and what we need to do to overcome all of this and bring the inflammation down so body now can actually start healing. Because if you're constantly inflamed, you're not healing. You're going towards a process of disease, not towards healing. So this is very interesting. Anybody that comes to my practice as a patient, everybody is inflamed. So we check, where is it coming from? Is it coming from your digestive tract? So we can take proper steps to overcome inflammation. So typical patients, I actually had a coaching call yesterday with my patient. So she's in a program, she's going in month 4. Firstly, she was not a big woman. She's a beautiful but middle height and weight woman. I wouldn't say she was crazy anything. She's in like early 30s. First complaint when she came, I'm always bloated. She cannot wear tight pants. She cannot wear beautiful outfits. Now everybody wants to wear that when they go to the gym. She can't wear it. She's like, I cannot hide my stomach. I can eat nothing, drink water. I'm already bloated. Like going like this to the gym, you don't want to show this to people. People get self-conscious. So when I start working with her, of course, she's doing all of this for herself. Plus she wants to have a child soon. So she wants to be healthy enough to conceive. So see, this is an educated consumer that knows the planning. She's like, well, something is off. Let me not wait until it really gets out of control. Let me look into it. So she came, we did blood work, we did all the diagnostics, reveal stage. I explained to her, we did hormones, thyroid is not okay already. We know due to inflammation, thyroid is not functioning, not enough progesterone, too much estradiol, all of these markers. Also, her immune system is already triggered. By looking at her blood test, a reveal stage, I had told her, I said, I will inform you because you need to know this. Most probably you're not even ovulating because everything indicates she has polycystic ovarian syndrome. Why this is so important? So if inflammation in the gut, reproductive organs swim in the same liquid. So if your gut is inflamed, so will be your reproductive organs. Don't be surprised. So yesterday she sent us a text message. Number one, we always in contact with our patients and we are at weight loss clinic. We're doing this anti-inflammatory, anti-aging program with her, immune regulation and modulation. So she lost about 25 pounds. I didn't ask her to exercise. No exercise. Let's reduce inflammation as naturally as possible. Change how you're sleeping, how you're eating. It's very precise to her because the precision is a key here. Let's see how it goes and we'll make appropriate adjustments. So yesterday she actually was able to see that she ovulates. Now she's ovulating and she's beyond happy. She lost so much weight. She looks great. She feels great. She has lots of energy. And we're only in 4th month. It doesn't take years. And I constantly say, once you do things right, it doesn't take forever. It's quite fast. People see results very quickly. A protocol that you have, every protocol is very specific to the individual need. She also was very fungi-like. She always was very stuffy. We tested and I said, listen, looks like you have fungi in your house. You need to get rid of it as well. They hired a company, came, they treated the house. I gave her something for the nose as well to get rid of the mold out of her sinuses. Sinuses are clear. So once we do this work, we do the inside and we do it as outside because sinuses are out. They're more or less external because you have nasal passage in which is open. It has to be treated too. Just if somebody has mold in their sinuses, that causes inflammation too. That's why they're so stuffy all the time. In digestive tract, not proper bacteria causes inflammation of the stomach. If somebody has leaky gut, because your immune system, everything, 70% of your immune system, activation of anything and everything like your hormones depends on how healthy your gut is. So if your gut is not healthy, your hormones not going to be optimum. You won't be able to detoxify. So the hormones that we have that we make, some we keep and we utilize, some have to leave the system. If they don't leave the system, they come back times 3. They are more toxic. You see how everything is connected. So understanding the burden, what's causing this? Maybe it's deficiency, maybe it's toxicity, maybe hormone is disbalance, maybe autoimmune system already went out of balance. So people say, I want to stimulate my immune function. I'm looking at them. You know what? I think we need to go vice versa. We have to not activate, but regulate because the immune system is already overly active. That's autoimmune disease. When due too much stimulation and too much burden of something, it could be virus, bacteria, parasite, constant inflammation of your system. Now you have an autoimmune disease or toxin. See, like everything is connected, everything. The system is one system. So if you really wanted to do this work, we always start with gut health because your immune system depends very heavily on the health of your gut, making sure that junctions are tight. So our gut lining is very specific. It's basically like a mesh-like structure. So more inflamed this mesh is, more loose it's going to be, loose. So if the structure is loose, the particles will leak out and irritate entire system and mucosa. So entire system goes into inflammation. When I have an older patient, well, older meaning in early 60s, mid 60s, and they say, oh, I have joint pain, I already know. They are so inflamed, it shows through their joints. Once we make corrections, joint pain goes away. So it is really amazing. We do heal through inflammatory states, but it's acute inflammation. It's not chronic inflammation. For example, for hair restoration, people use platelet-rich plasma, platelet-rich fibrin. So that's the other way how you use what your body gave by concentrating a lot of times inflammatory leukocytes and cytokines and re-inject them. So very important to understand when you do this that it really causes a lot of inflammation if you took this platelet-rich plasma out of patient that's already overly inflamed. Nobody talks about it. Like if you want to have good result and patient is already inflamed, you ideally want to put this patient through a program where you reduce inflammation and regulate the system, and then you use their platelet-rich plasma to induce some inflammation to the scalp and follicles for healing. You see some inflammation, not so much. That's why lots of people, when they do PRP, they say, oh, I'm going now through so much hair shedding. Is this normal? No, it's not normal. That means that you are overly inflamed. And now because it's too much inflammation to your system, now follicles are shedding. Your hair is shedding. Follicles are falling off. It's not ideal. We want to avoid this as much as possible. So I explain this process to the patient so they understand. The same thing for joints. We want to heal the joints and we want to create a state of inflammation in the joint. It could be hip, it could be knee. Again, if patient is overly inflamed and we do PRP, if you're not conscious enough how to do this properly, they swollen for next 2 weeks. So we need to treat patient first, get them in proper state where inflammation is regulated, and then use their cells for improvement of whatever else they wanted to improve. So it's a very specific process and understanding how body does this.
Yeah, fascinating. I have so many questions. So the early signs, right? And you mentioned there's a whole bunch. Fatigue, brain fog, skin changes, mood shifts. Is it always sequential that it starts from things like these and then it goes to, then you feel it at the last point coming on joint pains and body pains, body aches, or is there no sequence?
There is no sequence to it. There is no sequence. Usually people show where the weakest system of their body. This is where they show first. So usually if somebody comes to me and they say, I have a brain fog, I already know they're also anxious, depressed, and they have digestive issues. Like, I know it comes together. Like, if your brain is foggy, you also have gut issues and all the other issues that go with it. If they have pain in arthritic joints, it's not one joint, it's more than one joint. Let's figure out which joints are affected. It's also ligaments that also inflame because joints, they swell, but ligaments swell too. That's a soft tissue and hard tissue. So for everybody's specific signs, for women with PCOS, polycystic ovarian syndrome, what does this mean? Their digestive tract is inflamed, the gut is inflamed, so reproductive organs in the same fluid that disrupts itself, hormone release and production, because some of the hormones we release out of reproductive hormones, we release out of the adrenals, and some come out of the ovaries. So for those hormones that we release out of the ovaries, and ovaries already inflamed, and gut is inflamed because that's what regulates everything, what do you think happens? They don't ovulate regularly. So instead of releasing the egg creates a cyst. These women can menstruate, but they don't always ovulate. They don't release an egg. So in order to make that egg released, I'm not telling people, let's start with hormones right away. No, we don't do that. Let's correct everything, the environment like gut, let's correct that. And hormones regulate by themselves. We don't need to even touch that here. Like I did it for my patient. We did a lots of gut work, reduce inflammation through gut. And she starts ovulating by herself. I didn't give her progesterone or estradiol. I didn't give her those things. I didn't give her those hormones. Some people absolutely need, depending on age, on their physiological state of being. Not everybody needs that. So this is really specific. Also for people who have joint issues, we also know their joints are issues because their thyroid is not optimum and most probably inflamed. And also adrenals, because thyroid and adrenals are very tightly connected. You see, it's like very specific understanding of physiological state to understand how to correct this. So we support patients' adrenal glands, reduce inflammation through reduction of cortisol levels. Because cortisol, everybody's stressed out nowadays. People work too much and they overstimulated all the time. Look at kids. They constantly on the phone. This phone is overstimulation. They constantly on the phone. It's not the correct way. They shouldn't be doing this. Growing up like we grew up, like we were raised. Vivek, how was your childhood? Did you have fun?
I had a lot of fun. I had no phone until college, so it
See?
was
I didn't have phone for a very long time. Either I didn't have a computer, but I'm also older than you. So I was raised, a lot of my time was spent outside, outdoors, with my friends, with my girlfriends, running around, having fun. Now our little children, what do? They're home constantly on the phone. Like, what kind of childhood is this? We are not created to be like that. We are created to be in nature, spending time in nature. Also sleeping. People sleep less and less. Now they go into their bed with the phone. This is EMF device, right? It's disturb your natural rhythm of your hormonal release. So when I have patients that want to improve their reproduction, women, and they wear the Oura Ring or smartwatch, my question is it possible just to remove? Everybody's so glued to it. We need to understand that it creates a wavelength that actually disturbs your natural wavelength of energy of your system, that disturbs it. You need to repair at night. So people sleep less than 7 hours. When I have a patient, depending on what their state of well-being is, the order for them, if they're sicker they are, more they need to sleep. Firstly, we teach them sleep. It's sleep hygiene. And they have to sleep no less than 9 hours a lot of time. And if they exercise, no more exercise. Like, it's very specific. How do we allocate energy? Where is it going to go? You over-exercise, all your energy went through exercising, not into healing. So it is specific, and we have to do it in such a way not to create extra stress. If you want to eliminate stress, that's why we tell patients it's all done for you. System, you just follow. Support is there, program is there. I design everything. I have coaches constantly on top of my patients. Open line for communication. You have questions, just text us. We'll respond right away. And they see it's very quick to release the stress, because stress itself, more cortisol, more inflammation, you see? So we do everything as much as possible to reduce stress. But if we have an individual that constantly working in job very intense, we always explain to them, if you do not prioritize properly, your system will work as it does. Yes, there will be some improvement, but because you didn't prioritize your energy spent appropriately and it's still stressed out, don't be surprised, because your body can just do so much. This is so important. We want to make sure people understand that if you want to do healing work, you have to have appropriate base so your body can heal. Thinking that you can sleep 5 hours a night and undereat and be deficient and being stressed out all the time and all your electronic devices all the time and thinking it's gonna, your body will heal. It doesn't. We need to create a space, appropriate space for healing. People don't do just great. So we educate a lot of our patients. It's just part of it because people need to understand. And that happens very much in the beginning before I even offer them a program. My question is always your well-being, how important it is for you. Like if it is number 5 on your list, that's not the right time for you to do this. You have to be number 1 for yourself, and then we can do this together. I'll walk with you. My team will walk with you through this process. So you have this beautiful result. If you're prioritizing other people's needs, you see it's a problem number 1 and priorities of self, when they always push back, it always ends with autoimmune disease. I see it all the time. Most of women that come with Hashimoto's thyroiditis, lupus, Sjogren's disease, these women usually are first children in a family that had a lot of responsibility to take care of the siblings and never had a voice or never had time for themselves. So at first it's a family, siblings, and then it's school, and then it's marriage, children, and it's always the husbands, and they always last. So when they are in their mid-40s or early 50s, and then they have chronic diseases. There's diabetes or autoimmune disease. Why is this happening? It's happening because you did not self-prioritize. So body is absolutely beautiful and resilient. It takes so much before it starts kind of trickling down. It takes a lot.
Yeah, I mean, this is going back to you're talking about that patient, that lady who came in, and now you're already very quickly saw the results, right? So does that mean that this person did not have chronic inflammation? Because that builds over time, right? And that takes.
It takes decades. Of course she had. All of these symptoms builds up. So as we are, everybody is busy, everybody works. Very seldom you find somebody who doesn't work or doesn't work two jobs. I take care of people who are CEOs of the big companies. They always on a go. Always. So what we do, we don't pay attention to the signals the body is sending us. We don't see it because we're functional. You get a little tired, you take coffee, and then your coffee becomes every morning routine. Then you don't have enough energy, then you take an energy drink after coffee because coffee is not enough anymore. And then it builds up on and on and on. And you see that your life is really not your own anymore because you're not functioning the way you were functioning when you were 25. Of course, you're now 42. I understand you won't be functioning, but the amount of stimulation that you receive for you to function, it's ridiculous. So if your body needs so much stimulation for you to function just to get by, it's not a great thing. And body, it's forgiving, but eventually it takes a toll on the body. And then these people, they have all of these issues. And again, when we're talking about reproduction, body doesn't have to reproduce. Body has to keep you alive. And therefore, energy spent goes into your brain, lungs, heart, and some into your guts. You see, guts are not a priority because even if your bowel doesn't work, you're still going to be alive. So by the time we have women in their early 40s, mid 30s, they already went through all of this. And when they come, it's all over the place. Now they need a lot of support. And then we do fertility optimization. Yeah, we do fertility optimization. It's not just gonads. We have to optimize fertility. We go through entire system again, through everything again. Are they missing something? Are they toxic with something? And what are their hormones? Are they releasing enough? They're not releasing. Let's support. Reduce inflammation. Always. Number one, we need to understand where it's coming from and how we can overcome this. Even dietary plans that I recommend to my patients are never the same because physiologically people are so different. That's why this Google dieting doesn't really work. Supplementation regimen is different to each individual. I don't even prescribe vitamin D from the beginning to most people because they can't utilize this and they cannot convert it into active vitamin D in their system because of so much inflammation in their digestive tract. See, we go reduce inflammation digestive tract, teach digestive system to absorb. Why waste product? So we teach the system for absorption and then give very simple AD and K. And lots of times if I give it, I even give it oral. So they put drops in their mouth and they don't have to swallow it. So it goes into systemic circulation, avoiding digestion. So it's very interesting kind of work. Throughout all of these podcasts, we did this. Well, inflammation, we always address it because if you don't address inflammation, you're never going to get anywhere. People are not going to feel better. You're not going to change their physiology. So why do anything?
Again, chronic inflammation can still be done at that speed, reverse at that speed as how you say.
Yes, patients feel it very quickly, very quickly. So I told you about the example yesterday. I have a gentleman who is almost 30. He's in finance, but the problem was him. Yes, he was, kind of gaining weight and could not control this anymore. And weight was gained very specific areas. And we know it's adrenal driven weight gain because it's like a tie around his waist. And we know this. Very anxious, somewhat depressed, could not function, put him through program. He start feeling difference on month 2. It's like 5.5 weeks. Start saying, oh, I feel better. I'm not so anxious anymore. In week number 6, he actually was able to working again. He hasn't worked for years because anxiety was so severe. He's working. He's not depressed anymore. He's no longer anxious. He lost 35 pounds. And again, we are not weight loss program. I tell patients all the time, weight gain is the sign of inflammation because when we are born, we have the same amount of fat cells. The same. They don't get more, they don't get less if you don't do liposuction, honestly. Like cells amount is the same. So what happens to those when people are inflamed, the fat cells expand. When people are working through reduction of the inflammation, fat cells reduce. Do we need the fat cells? Of course we need for metabolism. We need that the cells that are there, they're not there to harm us. But when we have so much inflammation, the fat cells expand and they become very big. And when fat cell is big, it also releases hormones such as estrogen. lifestyle estrogen to men. And that's why very inflamed men look more like women now. They have big breasts and they gain weight. See, it is very, very interesting. By just reducing inflammation, whichever way these people need it, teach them to sleep, change the food, supplementation, supporting hormones, whatever toxicity, get rid of, create balance, a body heals. I see it all the time. And it doesn't matter how sick these people are, they all repair. That's why I love this work. We are God-created beings. Seeing how God created us so we can still repair, it's absolutely amazing. It is. It's amazing.
Speaking of specifically with fertility, so how does inflammation directly interfere with conception, both for men and women? Can you talk about that?
Absolutely. I think we already spoke about it, but I'll say it again. It's very interesting process. So in order for a woman to get pregnant, so many different things have to work together at the same time. Let's say, and I think I already kind of painted this picture before. So if man is healthy, his sperm should be able to find out where to swim. It needs to hear the egg because that's how they communicate, right? They need to hear the signal that comes from the ova moving upwards direction fast enough. If woman is inflamed, her mucus, vaginal mucus, will be thick. And the sperm, even if it's healthy, never going to be able to get through. Step number one. So this mucus, the vaginal mucus, it's so important. If woman is inflamed, when we have inflammation, everything in the system becomes very stagnant. Lymphatic system lymph becomes very thick like jello. Nothing moves. Any mucus you're making, it gets very, very thick. Even vaginal mucus get thick, so sperm cannot get through. See? Number one, we're starting from the bottom up. Let me paint this picture more. Let's say mucus is not the problem and sperm is healthy. Moving up through vagina, through the cervix, and gets into the uterine cavity because it has to get through the uterus and then through fallopian tubes. If uterine muscle is very inflamed, it's very thick. Sperm can get lost in there because it's so thick. If it is healthy, it will find its way opening of fallopian tubes to get out from fallopian tubes. So 1/3 of fallopian tube on outside, this is where egg, ova, and a sperm meet to create zygote. So if woman healthy, she will release an egg in proper time. If she has polycystic ovarian syndrome, egg will never be released. So the egg will be halfway released, creating a cyst. Super sperm, still making it, but if there is no egg, no pregnancy. Let's say woman actually ovulated and there is an egg and egg is waiting because that's how it works. So sperm needs to get into the egg and fastest sperm that ova chooses will get married. She chooses all the time. She just doesn't just allow any sperm to get in. Ova chooses. We do not know how she chooses, but she does. So if she chooses, it would work. But now we're talking about fallopian tube. So if a woman has chronic inflammation or had pelvic inflammatory disease, fallopian tubes get narrower and get closed. So the sperm cannot get through to marry the egg. Do you see how much has to happen? So we talked about women's side. Let's talk about men's side. When men are inflamed, they don't make enough. A lot of times they don't make sperm at all. Let's say they do make enough sperm. What about sperm movement? Can it move in proper fashion? Can it move upwards? Is it moving fast enough? What about morphology? Does it have all the particles that needs to be there? What about DNA of the sperm? How fragmented it is? Is it fragmented? If DNA fragmented and sperm is moving, no healthy embryo will happen. So a lot has to happen on the part of the partner, create this beautiful being. So you see, but what affects inflammation and reproductive organs? Everything we talked about. Everything we talked about. If gut is inflamed, then everything really is inflamed. Then people have autoimmune disease. And if that is happening, do not be expecting anything. So when patients go to IVF clinic and IVFs do their job, the job of IVF is to get a healthy egg, find the best sperm that this man ejaculated with, his sample, her sample, create a healthy embryo, and then replace this embryo and put it into the uterus so it can grow. I have these patients too. These patients lots of times because base work and inflammation reduction never took place. We're talking only about inflammation. We're not talking about hormonal regulation. So these poor people do this so many times and it does not work and nothing gets changed. And then they find me and then we do work appropriately. I have to educate them and do that all the time. Firstly, we need to make sure inflammation is reduced and everything is regulated. Embryo embryo can thrive, in order to have healthy embryo, you have to have man and a woman. So they can have healthier genetic material to create this embryo. You see? When people go to IVF, doctors take the best sperm that men had produced. It doesn't mean it's the best. It's the best that men produce. And the best egg that woman produced. It doesn't mean they created the best of anything. So when you're buying something in a store, Vivek, let me ask you this, and you're going to keep this, whatever you bought, for the rest of your life. What quality of that thing do you want? People don't understand. I explain to them again, like, it's going to be a child. Do you want a mediocre child, or you want the best of the best child you can get? That's a time where you think about it. What's going to change your life? Because your child is your child. You cannot throw out your child. It's your child. So whatever child you ended up with, that's a child you're going to spend the rest of your life with. I have patients that they want shortcuts. Oh, I want everything and I want it yesterday. It's not happening. If you already have an issue and you're not able to conceive and you're trying for so many plus years, it's a big issue. A lot of people don't understand what has to happen for child to be healthy. A lot of things have to improve before they go through this process. I don't want to have a mediocre child. And last time we spoke with you, I think I told you I did a specific detox before I had my last two children because I was already over 35 and I wanted to make sure they're as healthy as possible because I knew it's my children. I'm going to end up with these children. So I want to do my best so they are as best as possible, as healthy as possible. People need to be educated. They're not understanding. And I think it's a big problem.
I can be open here, right? I told you we went through IVF in the first one, told us about the best of the best quality thing, right? There was no discussion about those things. Like, is this the best you can do? Is this the best we have? All was done is like, you did it, your sample, you did your sample. Now it's our job to do whatever we do, right? I don't know why there wasn't and why there isn't. Like, I still feel like I meet with so many couples and friends at my age group is supposedly that age group. So there's a lot of people I meet and never heard this. So I don't know why is that the case, but unfortunately that's the state. Like, I just get surprised. I hope our listeners take a note and ask these questions. So that's important part here. I want to ask you next question on why does certain inflammation can turn into autoimmune, right? And is there again signs for that, or is it very common? Like how, and if somebody goes into autoimmune, then is the reversal path exist or that too long? What's the answer to that?
So in order for any chronic inflammation to cause autoimmunity, these people are inflamed for a long period of time, very long, decades. It's undiagnosed, undertreated. Patients didn't do anything about it, and then it turns to be an autoimmune condition. So in order to heal, still healing is a process. And a lot of times this is reversible. I see ANA positive, then we do some work over not 6 months, 2 years, 3 years, ANA negative. I see it. I show them. See, I was like, look, you're positive, joint pain, all of that. We work together now. It's negative. So when you remove this toxin burden, inflammation of the system corrects again. So now let me explain this to you. Firstly, 30% of all, even almost 40% of all female population has autoimmune disease. Every third patient that comes to me has either Hashimoto thyroiditis or ANA positive, like Sjogren's, lupus. I see in women all the time. Now I start seeing it at men. It wasn't the case before. I test now men and some men are like that. Interesting. So now question is why women more triggered towards autoimmune disease than men. Firstly, we carry children. And children biologically, not just our children. If I'm pregnant, the embryo I have, the fetus I have, it's part of my husband, it's part me. It's not all 100% mine, right? So my system, when child is born through vaginal delivery, of course, there is an exchange of amniotic fluid, a little bit. When it gets into systemic circulation, a little bit, but small, tiny, my system as a female can get triggered. That's a first cause why women get more autoimmune disease than men. If that happens, and that's why we have 30% of all women, every third patient I have, they have autoimmune disease. Also, the load of toxins and chronic inflammation goes into play. Also, all trauma. Let me explain this to you. What I see in my practice, a woman had a very specific traumatic event, like traumatic relationship. It could be physically traumatizing, psychologically traumatizing, and sexually traumatizing, or vice versa, one or the other. These women, after this relationship experience, 9 to 10 months later, get diagnosed with autoimmune disease because trauma is inflammatory. Don't forget, when you traumatize, your cortisol goes up and everything goes haywire. I ask my patients, like, you have this, especially for the women who never had babies. I know that they had some kind of traumatic experience. They resolve it too. It's specific therapy that we do called soul travel, but it's very specific to get them into traumatic event and then reprogram it without re-traumatizing them. And body just releases that traumatic burden. It's very interesting. Very interesting. Body heals. That's why, as I said, I love this because body heals no matter what. You just have to do it right.
That's the magic of our human body, right? So one last question on this thing. So people who are trying to lower the inflammation, right? There are ways to support that. There are things that sometimes are shocking or stressful or stress it back. Like there are extreme detox. So what's your recommendation if you're trying to do it without, shocking or stressing your body or inflammation?
Definitely. Number one, and I spoke about this again, we need to make sure everybody sleeps enough. It costs you nothing. Sleep enough. Reduce amount of EMF. Reduce the screen time. I'm on the computer all the time because I work. I have telehealth. I have patients online. All the time I order medication. Again, I'm ordering supplements. Everything is online. My husband looks at me, he's like, are you ever going to stop this? Yes, we need to still allow for our system to completely detach from all of this because that causes stress. And blue light itself causes stress to the system. That costs you nothing. You just have to prioritize. I'm also learning to do this because now it's such an active part of life, active part of work, of being on electronic devices. Proper supplementation. You need to understand what you're missing. You don't need to stress yourself. Stressing about something is not going to resolve your issue. It's going to make your issue worse. That's why when I'm explaining to my patients, I say, it's all done for you. We do it all for you. Don't think about anything. We've done it for so many years. We can guide you through. Forget about what you need to do. You just follow the steps. That's it. Already reducing the stress. Oura ring. Oh my God. Take it off. Stop tracking. I have patients that body temperature every morning. Ovulate, not ovulate. Stop all of that. I tell them for 4 months, you do nothing. You stop. Some that need to do this. Some. Stop everything right now. We are not doing anything for 4 months. I want to reduce the cortisol. So a lots of different things every individual can do without paying anybody. Don't pay anybody. Just take those steps. Stress, also self-induced. Sometimes we make small things a big thing. Don't create a big problem out of small problem. A lot of things we do by ourselves because we're so all triggered already. To us, small thing is already big problem. I had a patient, which is very lovely. Her husband is completely azoospermic, no sperm there. He's not my patient. She's my patient. Where we had this temperature change. Florida became very cold. So she calling me the second week it was cold. Oh my God, Dr. Yuabova, I don't have my period. I tested for pregnancy 3 times. It's negative. My question, why are you so stressed? Your husband has no sperm. Why are you testing? Oh, I was so regular all the time. You could not be regular all the time because you're a woman. There is no woman that's always regular. Number one, bring this down. Number two, you're going through a cold wave. Your body is not stupid. It doesn't have enough heat. It's not going to release. When we menstruate, we release heat. You have to teach them. Your body doesn't have energy to release heat. You're cold. You're not wearing socks. Go put your socks on. Give 3 to 5 days. Keep yourself warm. You're going to menstruate. Relax. Stop driving yourself crazy. You see, your body is so smart. Trust the process. Trust your body. It will do it. So that's how it should be done. Stress less. To my patients, stress less. Stress is a big thing in inflammatory process. That causes a lot of inflammation.
This has been great. I think a lot of confusion is around this very, very nuanced topic. Everybody just get mixed up, how I was saying. But I think this conversation today, you have clarified a lot of things. And I'm sure our listeners are going to benefit from that. So I want to conclude this conversation. But before that, I want to say the biggest takeaway here is inflammation isn't your enemy. It is your body trying to protect you. The problem isn't that inflammation exists, but it is when it never turns off. And that's when you want to understand much deeper what's happening. And again, if you want to reach out to Dr. Yuabova, you can schedule your Reveal consultation at National Wellness Group at her location in Boca or visit their website, nationalwellnessgroup.com. Once again, Dr. Yuabova, thank you for sharing all the insights and thank you for our listeners and keep coming back. Thank you.
Thank you for having me.